Good day, I'm Geraldine Arizari, and today I'm going to demonstrate the applying of cold compress or cold therapy. Cold compress or cold therapy is a local application of cold to the prescribed area with the use of crushed ice. Assessment. First, assess the situation to determine the appropriateness for the application of cold therapy. Second, assess the patient's physical and mental status and the condition of the body area to be treated with the cold therapy. Third, confirm the physician's order, including the frequency, the type of therapy, the body area to be treated, and the length of time for the application. Fourth, check if antipyretic medications have been administered. Identify the time, the type, amount, and response in addition to the application of cold therapy. And then next, observe fluid and electrolyte status, especially in patients with elevated temperature. And then lastly, assess the baseline vital signs or assess any hazards to patients' vital functions with application of the cold therapy. Objectives. First, to promote vasoconstriction. Second, to decrease edema. Third, to reduce pain. Fourth, to decrease temperature. And then fifth, to decrease or stop bleeding. Procedure. First, review the physician's order for the application of cold therapy, including the frequency, the type of therapy, the body area to be treated, and the length of time for the application. Number two, gather all the necessary supplies. So these are the things we need. So we need towel or washcloth, the ice bag, and then the crushed ice, and then a gauze wrap or tape. We might need it later. So these are the materials we need for the applying of cold therapy. Third, identify the patient. Determine if the patient had or has any previous adverse reaction to cold therapy. Hello, sir. Good morning. So can you please state your name, sir?
Gerald.
Okay, Sir Gerald, did you have any previous adverse or unusual reaction to cold compress or cold therapy?
No, I don't have.
Okay, none. Fourth, explain the procedure. So today, sir, I'm going to apply cold compress on your left shoulder as prescribed by the doctor. So it will be 3 times a day and it will take 20 minutes. Next, assess the condition of the skin where the ice is to be placed. Okay. Next, perform hand hygiene. Close the room doors or curtains and place the bed in a comfortable working height. Next, assist the patient in a comfortable position. That provides easy access to the area to be treated, and then expose the area. And drape the patient with bath blanket if necessary. Put the waterproof pad under the wound area if necessary. And the next, prepare device. Fill the bag about 3/4 full of ice. Remove any excess air from the device. And then securely fasten the end of the bag or the ice bag. Check for any holes or leakage of water. And then cover your device with towel or washcloth. Next, put on gloves if necessary. Place the cooling device on top of the dressing or top of the skin and lightly secure it in place as needed. Okay. And then remove the ice and assess the skin for redness after 30 seconds. Okay, let's presume it's already 30 seconds. Okay, so there is no redness. And then ask the patient for the presence of burning sensation. So sir, did you feel any burning sensations when in your left shoulder when you apply the cold compress?
No, I didn't.
Okay. Okay. And then replace the device snugly against the side if no problems are evident. And secure it in a place with gauze wrap or tape. Then reassess the treatment area every 5 minutes. So let's presume it's already 5 minutes. I'm gonna check. Okay, assess the area. Okay. And then after 20 minutes, remove the ice bag and dry the skin. So let's presume that the prescribed time is reached. So it's already 20 minutes. So I'm gonna remove the bag, and then if there's any moisture present, dry it with a towel. So there's none. And then apply a new dressing if necessary to the site. And then lastly, perform hand hygiene. For the evaluation, edema is slowed or reduced locally. Patient's internal temperature is reduced, pain is reduced or alleviated, and bleeding is reduced or alleviated. So for the reporting and recording, in the assessment, we apply the cold compress or the cold therapy to the patient's left shoulder for about 20 minutes. And then before the assessment, the patient's left shoulder was swelling, but after applying the cold compress or the cold therapy, the swelling was relieved in the patient's left shoulder.